Well, 2020 Democrats throwing their weight behind Medicare for all.
The best way to go forward, in my view, is through a Medicare for all single-payer program.
Now, I say Medicare for all, expanding health care, lowering costs.
I believe the solution, and I'm actually feel very strongly about this, is that we need to have Medicare for all.
Well, today the House is set to hold the first ever hearing on the plan. Does this signal that Medicare for all is closer than ever? Here now to weigh in is the founder and CEO of Juniper Research Group, Chris Jacobs. Thank you so much for joining us this morning. We appreciate it.
Great to be with you, Heather.
So what do you think? Why are they doing this?
Well, this is a case where the left hand doesn't know what the far left hand is doing. We've seen polls indicate that the idea of Medicare for all sounds popular. But when the American people realize that this will raise taxes by $32 trillion, abolish private health insurance, and, oh, by the way, abolish Medicare for millions of seniors, I don't think they're going to like it.
Yeah, we also know it would come at a cost of $32.6 trillion over the next 10 years for Medicare for all. Do you think there will be any indication as to how we'll pay for it coming out of this?
We haven't seen much thus far. The Congressional Budget Office is releasing some type of report on Wednesday regarding the issues surrounding paying for this legislation. Senator Sanders has put out a menu of 5 or 6 different options to tax increases, of course, to pay for it. The House sponsors of the legislation haven't even bothered to go that far.
Is this Rules Committee hearing basically an effort to make the idea perhaps more mainstream?
Perhaps, but I think once people actually get into the details of the legislation, they will see, A, why it won't work, and B, why it will leave poorer quality health care to the American people. There's a provision in the House bill that prevents the federal government from paying providers based on quality. In other words, poor doctors get paid the same as good doctors. What patient wants that?
But is that anything that you expect to hear, any of the reality of what it will cause down the road? And true facts, like you just discussed, do you think that will be discussed?
I hope it will. And I hope, and this is why I've been writing about it and trying to raise concerns, I think Senator Sanders is very good talking in bland generalities about making health care a human right, health care for all, free stuff. Nobody will have to pay anything. I think once you actually get down into the details of the legislation, that's when the American people will realize how this will harm them.
It's interesting that the Congressional Budget Office is expected to release a report following this hearing today in terms of the cost.
Well, that's correct. And I don't think actually, based on what we've heard, Heather, they're not actually going to say, here's how much it will cost. It's more going to be a menu of options of how to structure a bill. Senator Sanders is the ranking member on the Senate Budget Committee. He should get the Congressional Budget Office to score his bill if he wants it that badly. The question is, does he want to know the answer to that question?
Yeah, in terms of 2020, the 2020 run and all of the Democratic candidates, is this a wise road to go down?
I don't think so. The American people don't want socialism. This is $32 trillion of tax increases. I think there's one survey that said 71% of families will pay more under one version of the Sanders plan than they would under the status quo. That's not a policy that the American people would support.
All right. Chris Jacobs live for us this morning, breaking it down. We appreciate your time. Thank you.
Thanks very much.
All right.